Hi, I am Dr. Arijit Dutta Chowdhury, and today I am back with my series of videos on various psychological issues. So, today I am going to discuss about the various side effects of psychotropic drugs, which I often get the queries from patients when I prescribe them. Many of them go to Google and search and find various side effects, and then they get very much bothered about these, and it affects the medicine compliance. So, the first, I will say that what the common questions I get by the patients, and then I will try to make a gist of the side effects, probable side effects, because it is very difficult to talk about all the side effects of various psychotropic drugs, as we know that these drugs are not a very small number. They have it's a long list of drugs, and there are from various classes like antidepressants, antipsychotics, mood stabilizers, anxiolytics, sedatives. So we'll focus on the overall general thing, which may be common to most of them, and not about individual drugs. So the common questions I face is like the maximum concern I get about the long-term side effects. Many patients ask me whether these drugs do produce long-term side effects like damaging liver, kidney, heart, etc. This is one concern. Then another concern is that whether these drugs will affect the pregnant mother, or even if the father takes, whether if he is going to be a father, and whether these drugs will have some effect with his babies and all. These are the two major concerns I get. And in addition to that, whether these drugs will affect, another big concern is the sleep. Many people think that these drugs will cause them very much drowsy, so whether they will feel drowsy and weak, whether they will be able to carry out day-to-day work. These are also very common queries. So to answer these queries, the first of the things is like chronic side effects about the major organs. These drugs, most psychotropic drugs, they come into the market after a long-term trials, because these drugs are supposed to be taken in long term. So yes, no, these drugs don't produce long-term side effects on your organs mostly, unless there is some kind of physical problem. Yes, if some kind of physical problem is there, then these drugs may exacerbate that problem, and then the physician, the psychiatrist has to choose like which condition and which drug has to be given. There are very few drugs which may give rise to some chronic problems in long term, like say there is a drug lithium which is used in bipolar disorder. So that drug in very long term use, it may cause some kidney problem. Yes, that is there. But considering if you consider the whole list of drugs, those kind of examples are not very much there. And obviously, any drug has any kind of serious or potential side effects that will be mentioned by the treating psychiatrist. That is the norm. So you get to know. So and the sedation thing is also like these questions come to the mind, because just say around 20 years ago, 2 decades ago, most of the psychiatric drugs, they are like sedatives, but now it has changed. Now we have a lot of non-sedative drugs, so we don't prescribe sedative drugs unless it is needed by the patients. So if a patient is having fine sleep, we usually don't prescribe sedative drugs. So no, not that just by taking drugs you get sedation. It is not like that. And coming to the pregnancy issue, yes, the mother is not supposed to take any psychiatric drug ideally when pregnant, because all these drugs have a potential to cause some kind of harm to the fetus. So ideally, mother should not take. But if it is absolutely necessary, right, like there are some psychological conditions which may exacerbate when the mother is off drug, and that may cause more harm than benefit to the kid. So the coming kid. So that time the clinical judgment is very important, whether to give the drug or not to give. But it is, yes, ideally it should not be given during pregnancy, most of these drugs. And if the father takes, no problem. That these drugs, they don't get secreted through the father's sperm and then go to the baby's body. So if the father takes, that is fine. That doesn't matter. Then coming to the common side effects, what you usually get, people think about major side effects, but they don't happen. But common side effects, minor side effects, yes, they do happen, and that is what we should think about more than the rare things which don't happen. So the common side effects of most of these drugs are, one is this already discussed sedation, but not all, depends on which drug. So we can choose it whether we need sedation or not. Then comes this GI side effects, gastrointestinal side effects like acidity, like constipation. Yes, this is very common, happens with many drugs. But the good thing is most of these gastrointestinal side effects, they are for the initial period, say the initial 2 weeks or so. After that, it passes away. So if it happens, then for the initial period it can be treated in a like symptomatic way. Like for acidity, we can give some acid blocker. For constipation, we can give some laxative like that. Then comes this dizziness and headache. These are also not very uncommon. Many people get dizzy in the initial days or have mild headaches or heaviness in head. So these are also very mild and self-limiting side effects for the initial 2 weeks or so, and then usually it goes away. So the best way to tackle these side effects are having a good fluid intake, having a lot of fluid that helps in preventing most of this dizziness and all. And other than that, we also get skin rashes. Some drugs cause skin rashes. So the drugs which cause it, usually it is mentioned by the psychiatrist in the prescription that if the rash appears, then you have to stop this drug and consult. So rash is almost taken care of by the person who is prescribing. So it is, even if it is happens, it is not life-threatening or like that. In most of the cases, there are some drugs which cause very serious or life-threatening kind of rashes. That will also be mentioned by the treating psychiatrist. Rather than this, like some drugs cause mild swelling of feet, which you call technically called pedal edema. That also the drug can be changed to something else if it is like it is not a serious side effects. So these are the mostly the common side effects, and yes, these drugs are very important part of the treatment of a psychological condition. There is a lot of stigma against drugs. A lot of people think that okay, therapy is going to cure them, but actually they need medicines, and just fearing about side effects, fearing about things which don't happen because the long list is there in Google and we think that it might happen, so we don't take it. No, that is not the approach. The best part about these drugs is that whenever you have a prescription, if you have any doubt about what maybe the possible side effects of the drug, you should ask your psychiatrist. And if you find something in Google like which you think you get afraid, then just by searching Google and stopping the drug is not the issue. You should tell your concern to your psychiatrist and get clear about this, because most of the side effects, like there is a long list of side effects to most of the drugs, like the simple painkiller or the simple antibiotic or the simple antacid you take, that is also a long list of side effects, but those don't occur to everyone. So just a long list should not prevent you from taking medicines. Medicines are a very integral part of treatment of most of the psychiatric condition. Thank you.